it looks like it's going to get so much worse, and that's really frightening.
Health officials are warning Thanksgiving gatherings could lead to a surge in COVID-19 cases come Christmas. Thank you for joining us on air or wherever you're streaming us. I'm KRISTYN Hartman.
And I'm Craig McKee. Before Thanksgiving arrived, Ohio was already dealing with that spike. Of course, we reported on health officials worry that that trend will only continue now into the new year. Today, the state is reporting more than 7,800 daily cases and 123 deaths in just the last 24 hours. Daily hospitalizations also reached 436. Reporter MARIEL CARBONE takes a look at what's happening inside local hospitals and why officials are concerned tonight.
Well, the Hamilton County Health Commissioner says that he is optimistic that continued messaging to stay home for Thanksgiving worked. But we are only about a week away from the holiday, so it'll still take a little bit more time before we really know. Still, healthcare workers here say that they are preparing for an overload of cases over the next few weeks. The day before Thanksgiving, the TSA processed more than 1 million people in airports nationwide.
The airline's been doing a good job.
A frustrating fact for nurses like Megan Adams.
Spend a lot of time at work trying to do all the right things and take all the precautions.
Adams is with the Ohio Nurses Association. She says she understands the messaging to stay home this holiday season. Social distance and wear a mask is tiring, and some people aren't listening.
It feels like we're fighting this losing battle.
She fears COVID spread will only get worse.
I unfortunately think there's going to be a really stark wake-up call as we get into Christmas and into New Year's, and I really hope we're available to meet that challenge.
It's already a challenge in Southwest Ohio.
60 days ago, in our hospital systems, about 1 in 30 individuals in the hospital had COVID. We're now at a point where about 1 in 4.
That translates to a nearly 700% increase in the number of people hospitalized in our region just over the past 2 months. Dr. Richard Lofgren, CEO of UC Health, says the biggest threat to response efforts is staffing levels.
We're asking people and nurses to work overtime or double shifts and to sort of stretch themselves. And obviously, in some cases, that's not sustainable.
Adams agrees.
At a certain point of overload, we are inevitably going to reach a point of failure.
It'll be another week before the hospitals start to feel the impact of Thanksgiving travel as symptoms lag about 2 weeks. As the year closes out, Adams is asking people to remember what the holidays are all about.
This is a holiday about love, about giving. Love people enough, give enough to do the right thing.
Now, here in Hamilton County, to prepare for any surges, public health is hiring more contact tracers. Right now, there are about 100 people doing that work, with 3 new employees brought on full-time today. Reporting in Corryville, MARIEL CARBONE, WCPO 9 News.
And really quickly, we want to mention Ohio's vaccine distribution plan once the vaccines are approved by the FDA. Pfizer's COVID vaccine could be here by December 15th, and Moderna's vaccine is expected a week later. The Pfizer vaccine would be sent directly to the 10 hospital sites, including UC Health. As supply increases, other healthcare providers will receive direct shipments from Pfizer if they're ordering 975 doses or more. Providers requiring fewer than 975 doses will not receive direct shipment from Pfizer. The state also announced if the FDA approves the Moderna vaccine that it will be shipped directly to all providers giving the vaccine. It will not be processed at the state facility.